Good afternoon. My name is Nicole Clark, and I'm the Associate Director of Patient Advocacy for the Immune Deficiency Foundation. Thank you for joining us. Before we start today's session, I'd like to just go over a few reminders. Please remember that each patient's treatment and condition is unique. The content that is presented here in this session should not be used as a substitute for professional medical advice. In all cases, patients and caregivers should consult their healthcare providers. It's also important to remember that where you are on your journey of living with primary immunodeficiency may differ from that of others in the community. The severity of PI can vary, and we ask that you're supportive and respectful of one another as fellow members of the IDF community. At the end of the presentation, questions will be answered. Please submit your questions in the question box at the bottom of your screen. The presenter will answer as many questions as possible during that Q&A session time. So now it is my pleasure to welcome you to our breakout session. Can I really ask that question? Young adults and more. This session is presented by Dr. Terry Harville. Dr. Harville has been involved with patients with immunodeficiencies for more than 30 years and nearly as long with IDF. He's a consultant regarding immunodeficiencies, autoimmune disorders, and transplantation complications. Dr. Harville currently provides consulting services for the laboratory testing of patients and donors of organ, bone marrow, and hematopoietic cell transplantation. He is also a professor of internal medicine in the Division of Hematology and Oncology. It is my great pleasure to introduce Dr. Terry Harville.
Thank you very much, Nicole. I appreciate the opportunity that the IDF has for me today. And why don't we go ahead and get started here. The session that I was asked to present is unique and relevant, and it's some of the items I'm more familiar with than other items, and so bear with me as I go through the issues with you. We'll start with the discussion of issue of supplements, and this comes up quite a bit for individuals. And the thing I'd like to point out is that there are no cures for an immune deficiency via a supplement or some type of a natural product. There are things that may help to some extent, but there is no cure. And just to point out, there is a supplement called echinacea that has been touted to be very useful for the immune system, but careful studies have shown that it really doesn't provide any benefit. But there are some things that may actually provide some benefit. For example, the amino acid glutamine and the amino acid arginine have been shown to provide some benefit to the body. And in particular, if you want to grow cells in culture, the glutamine is absolutely required. There, many years ago, it was noted that the medications called H2 blockers would help cause warts to go away. And so famotidine and cimetidine, which are two of these medications, have been shown in some studies to be helpful for causing warts to go away, and therefore are thought to help provide an increase in improvement in antiviral immunity. Some studies have shown them not to be as beneficial, though. Zinc has been shown to help with wound healing. Zinc is really important for allowing the neutrophils to work appropriately. Vitamin D has been shown to be important and helps regulate the immune system in an appropriate manner. Different minerals such as calcium, magnesium are also important for keeping the body functioning more in a correct fashion. And the amino acid lysine is helpful for rebuilding tissues in the body. So while these don't directly necessarily cause a huge boost in the immune system. These can be helpful to nudge things in the direction that would be beneficial towards anyone, not just someone that has a primary immune deficiency. And if you have further questions about the use of these types of items, please go through the IDF, and they can connect you with me, and I can try to answer those questions more specifically. There's some other questions that people had sent in regarding supplements for body mass and muscle. And in general, taking these types of things are fine for anybody to use. What I'd like to suggest to you, though, is always be careful about receiving advice from a bodybuilder at the local gym. You want to receive your advice from a physician or nutritionist that has more medical knowledge about their use, not just testimonial knowledge or trying to sell a product. As we mentioned before, glutamine and arginine are very important amino acids for the way metabolism works, but also can be helpful for supporting muscles. The creatine that is hyped for muscle growth can actually cause the kidneys to be hurt. And so you want to be very careful about using this in a non-supervised fashion. And so if you are using the creatine supplement, please be careful and don't overdo it. There are several of these so-called testosterone boosters. These are very expensive hyped items, and studies have really indicated that they don't do much help. And so you spend a lot of money for something that probably doesn't provide the benefit that is hyped by the advertising. It's really important to not use anabolic steroids unless you're prescribed these by a physician for a specific reason. These can cause quite a bit of harm in the individual. And so while you might be hoping to try to make your muscles bigger and stronger, certainly taking anabolic steroids that you've bought off the street from somebody is not a good way of doing that, and could create much more harm than good. Moving on, there are questions that were raised about pets, and let me go through these for a few minutes. And as I note here, this is a difficult subject because there's so many variables that need to be considered. And part of these things, once you consider, would include things like the type of immune deficiency and the type of pet. And so one of the questions was, discuss pets that present an increased risk of individuals with primary immune deficiency. And in general, if you have pets that spend a lot of time outdoors, that these can bring back certain pathogens back into the home, and including things like Giardia and Salmonella. So patients that have antibody deficiencies that are at risk for Giardia infections, having a pet that goes outside, rolls around in animal poop, comes back with Giardia and can make somebody become ill. Someone has a deficiency that affects their neutrophil function, can develop very severe infections due to Salmonella that are obtained by the same sort of fashion. Another virus is called norovirus, which causes lots of intestinal problems in patients with antibody deficiencies. And once again, pets that wander around outside will pick this up from where it's been left by other animals or from human waste and bring that back into the home. Farm animals, it turns out, are extremely risky because most of the feeds and items that are used to take care of the farm animals contain antibiotics. And most farm animals have multiple resistant bacteria that are multiple resistant to a variety of antibiotics. And this is actually where most of the antibiotic resistance in this country comes from, not from the use of antibiotics in people, but actually in the use of the antibiotics in animals. And so if you work around farm animals, you're at much higher risk for contracting a microorganism that may be difficult to treat because it will be antibiotic resistant. Reptiles are notorious for distributing salmonella into individuals. Birds can have specific types of fungal organisms present. And so indoor pets, so cats or dogs that are indoor only, are very good companions for patients, for anybody, but in particular for patients having immune deficiency. And the indoor only animals will be at much lower risk for having picked up some kind of a pathogen from the environment that could be harmful. Birds are extremely good companions, and birds that are raised by reputable breeders are checked for specific types of infections because those can cause problems in the breeding of the birds. And so they want to be able to keep their business going. So they try to keep down these infections. Reptiles, the same thing. So turtles or snakes from reputable breeders that have been checked for salmonella can be good pets. They're not affectionate, meaning that they won't come up and sit in your lap the same way as a cat or a dog or perhaps a bird will. But many people enjoy raising snakes or turtles. What we've recommended over the years that perhaps the safest pet to have are aquarium fish because there's less chance of them spreading an infection to you. For any of these types of things, again, we want to re-mention that patients that have neutrophil problems need to be very careful because of the types of bacteria that sometimes can be spread can cause quite a bit of problems. And there's a question about vaccination in pets. And one of the differences between most of the vaccines that we as humans receive today versus those as pets are that pets will actually be receiving live viral vaccines. Now, most of these are organisms that are not permissive for infection into humans. So most of the time, we don't have a problem regarding those. Especially if what we call your T lymphocyte function is intact, then there's probably not much risk from these. But patients that have a diagnosis such as combined immune deficiency or severe combined immune deficiency who do not yet have full immune system reconstitution, that would recommend that they stay away from a pet for 2 to 4 weeks that has recently been immunized with a live viral vaccine, so that vaccine will have a chance to run its course in the animal and the animal has developed immunity so that there's not going to be potential risk of spread of the virus to someone with a compromised immunity. There are questions about dental related issues. And so, for example, does somebody with primary immune deficiency need to see a dentist more frequently? And this is a question that depends on your dental needs. And so if you're having a lot of problems with your teeth, a lot of cavities or other issues with your gums, then yes, you need to be seeing your dentist more frequently so these can be handled more appropriately. Otherwise, for most teenagers and adults, an annual visit is sufficient, where you have a teeth cleaning and a teeth examination to verify that there's nothing new going on that requires further intervention. And another question was, is it appropriate for individuals that have primary immune deficiency to take additional precautions when going to a dentist for the routine cleaning and checkup? So once again, under most circumstances, especially if you just have an uncomplicated antibody deficiency, that there's probably nothing more that needs to be done. The concern is that bacteria can be introduced in the bloodstream during the procedures. And so this is a problem for people that have neutropenia or a condition such as chronic granulomatous disease. So anyone that has neutrophils that do not function as well as they should, or have low numbers of neutrophils, may be at risk for the bacteria seeding their bloodstream. And so these individuals need to take antibiotics before going to see the dentist, and then typically an antibiotic dose after seeing the dentist, after the procedure is performed. And that usually is sufficient to take care of the small amount of bacteria that may be introduced during the procedure. And you can discuss this with your specific immunologist as to the dosing amount that you need, or if they feel for some reason that you need to be receiving more antibiotics than, say, someone else. And so it's always a good idea to discuss specifically what your needs are. Surgery. There are questions raised about such things as implants, including, for example, dental, knee, hip, breast, and what kind of precautions that need to be done. And so, and are there extra precautions that need to be in place? And the answer is yes, but it depends on a variety of things. So, for example, just in the list here, if someone has an antibody deficiency that's otherwise well controlled with their immunoglobulin replacement, and they're not having problems with the current infections or autoimmune diseases or other issues, there may not need to be any more precautions than are normally done with these procedures. When you're looking at joint replacements, generally antibiotics are given for a period of time to prevent them from becoming infected. But when you talk about, for example, having a tooth implanted or breast augmentation, generally antibiotics are not needed. But this would be something that you would discuss with your immunologist and the physician performing the procedure, where they may feel more of a need to just make sure that things are covered. But in general, if you have an antibody deficiency that is well controlled, probably not much more than is needed for the routine population. Those that have chronic granulomatous disease or other neutrophil problems will need increased antibiotics because they will be at higher risk for a variety of things. Neutrophils are very important for the healing of any wounds or incisions that may be made. And so it takes longer to heal after a surgical procedure if you have a neutrophil problem. And so antibiotics will be required during this time frame until the healing can be completed. So other things that involve neutrophil-related issues are sometimes patients that have conditions such as hyper-IgM syndrome or hyper-IgE syndrome. And so once again, may need higher doses of antibiotics as well as prolonged uses of antibiotics until the healing can be complete after the surgical procedures have been performed. And so when you're thinking about these issues, one needs to consider the need versus a risk. And so if one's well-being and quality of life will truly be improved by the procedure, and it can be done safely, then by all means proceed forward. But if it's being done for reasons that are not going to be that much more helpful for the person, then there should be careful discussion because you don't want to end up setting yourself up for having more and more problems to occur. And not to belabor it, but for example, if a breast implant is placed and then gets infected, that could create a more serious problem and worse presentation than had been before the procedure had been performed. So again, carefully discuss and think about, is this going to really improve things or not? And make sure all the extra precautions are done, especially if you have a neutrophil-related condition. So we're just discussing some issues that might be involved with cosmetic. And so there were questions about enhancement or cosmetic procedures. And does a patient with primary immune deficiency need to take extra precautions, or are these procedures solely contraindicated? And back to the things that we've been discussing, if a person has a neutropenia or the neutrophils don't work as well, so hyper-IgE syndrome, hyper-IgM syndrome, chronic granulomatous disease, any type of surgical process or anything that results in a cut or introduction of foreign material into the body can create problems because there are healing issues. Patients that have neutrophil-related disorders have a more difficult time in healing. So it should be taken with very caution about putting jewelry in certain parts of the body or having specific cuts performed because, again, the healing may not go as well. If a person has a combined immune deficiency or severe combined immune deficiency and does not have full immune system reconstitution, again, one might want to consider the risk of having a foreign body placed into the body regarding how that is going to improve the well-being of the person versus potentially create a long-term complications that may be difficult to deal with. Those that have antibody deficiencies that are on immune globulin replacement and are otherwise doing quite well may not have any higher, problems at higher risk than the general population. So the hierarchy involves people that have neutrophil-related conditions need to think very carefully about proceeding with anything that would potentially result in cutting of the body or introduction of foreign body to the body, because these just may not heal as well and result in long-term non-healing issues. So further issues related with enhancement and cosmetic. So tattoos, piercing, and gauging. So gauging is simply the process of finding the right size ring or jewelry that needs to be put into, or that would be used to pierce part of the body. Tattoos are a very interesting thing in that they've been around for literally thousands of years and have had primarily in the past religious or sect associated, which we could also call gang type purposes. These would identify you as belonging with a certain group. So for example, the Maori in New Zealand have very specific tattoo patterns that people place that identifies who they belong with. For the past 100 years or so, tattoos were primarily used for gang identification. And therefore, in the context for the last number of years, tattoos have generally had a bad connotation, meaning that the tattoo was identifying you as being part of a gang, which was usually equated to being part of some form of a criminal organization. Now that has changed in the last 20 years, and I'll talk about that a little bit more in a moment. Piercings, like tattoos, have been around for many, many years, for perhaps thousands of years. Primarily, the piercings have involved the nose and the ears. The ear jewelry is noted to be present even in Egyptian mummies. Nose piercing has been involved in certain religious sects that have been present, again, for hundreds, if not thousands of years. Such things as piercing of the navel, nipples, or other parts of the body is something that's a newer version of this and has been used in the past few years as a process of counterculturing. These have to be considered very carefully, again, from the healing standpoint. If you place a piercing through part of the body that can't heal very well, then you end up with long-term problems there and may have to have a surgical excision of that part of the body. So it's not something, once again, to do lightly in considering of issues. Again, gauging is just finding the right size of jewelry to use. Just to mention issues about jewelry and tattooing, the hospital I work in has very specific issues regarding tattooing. and that they have to be covered or hidden. So one can't have face, neck, or arm tattoos, or lower leg that have to be hidden away. Further, there can be no more than 3 small, what we call presentable earrings, and then no one can have nose piercings except if they are part of a Hindu background, religious background in there. And this is just to show you a patient with antibody deficiency. They gave me permission to use their picture, and they've had a tattoo. And you can see that having a discrete and appropriate tattoo isn't necessarily bad and can be done in patients that have primary immune deficiency. And so when we think about this, again, if you want tattoos, please be discreet and don't do something that in some day that you will regret what is being written on your body or an image that's been placed on your body. There are other issues regarding enhancements that one has to worry about are the risk for hepatitis B, hepatitis C, and HIV. And most state health departments have very specific guidelines, and the tattoo parlors and other places are checked for these. And so you will want to check with your individual state Department of Health and make sure that any business you'd be going to follows the guidelines and has been checked and is clearly free from these types of issues. Another issue regarding tattooing is that multiple tattooing piercings has been used by the medical community as an indicator of risk for hepatitis B, C, HIV. And so these patients are individuals that have had multiple tattoos are generally deferred as being organ or bone marrow donors because of the risk for these infectious agents. And so once again, these are sort of society issues, and this is changing. There are even now physicians that have multiple tattoos as younger individuals are moving into these areas. And so the concepts in society is changing on this, but the risks are real, and you will want to make sure that if you go for tattooing or piercings, that you go to a facility that is following the state guidelines and where you're not going to be at risk for acquiring one of these conditions. So other things about enhancements were pedicures, manicures, and once again, these have state guidelines, and so you might want to check with the health department and verify that any facility you'd go to is following the guidelines. And it's a problem for individuals that may have neutrophil disorders, so that there could be issues of getting an infection that might be difficult to treat. For most other immune abnormalities, having manicures or pedicures should not be a major issue. There are some issues or questions that were raised about Lasik contact lenses. Just as an aside, considering what we're dealing with COVID at the current time, glasses help prevent the acquisition of viral infections because you cover the eyes, and now the eyes are no longer a source for the virus to enter your body. Lasik has been around for a long time, but we still don't know what it's going to do over the lifetime of an individual. And so it may be that individuals will require some form of cataract or corneal surgeries when they get elderly because of the changes that occurred. And once again, we're going to note that people that have neutrophil issues may have healing problems or have additional infection problems that could result in severe eye disease if the infection occurs due to these. Contact lenses are relatively safe for patients with primary immune deficiency. Using disposable ones that are changed frequently would be the best route to go. We're moving on. Alcohols and drugs. Discuss the impact of alcohol on the immune system and primary immune deficiency. The bottom line of this is alcohol, ethyl alcohol, which is what's ethanol, which is what alcohol is that we drink, is a metabolic poison. So it interferes with a variety of systems. It can cause liver and brain damage. Metabolic side effects can weaken the immune system surveillance and make one at higher risk for infections. And so this becomes even more of an issue for patients with immune deficiency. What's important is to abide by the law, and if you're going to use in moderation, if used at all, because it can make you more susceptible to developing infections. Marijuana benefits in primary immune deficiency. Marijuana usage is still controversial. Now, recently, more states in the recent election have legalized the use of marijuana. So it still remains a federal crime, though, despite this legalization in individual states. And so this makes it still considered a problem. There have been many diseases and conditions that people hype that marijuana helps. Now, studies, some of these have shown benefit, and some have shown essentially no benefit. So be wary of something that's being considered as a cure-all. Okay, smoking marijuana is very dangerous, and so there's problems with things like Pseudomonas infections and Mycobacterial avian influenza infections. So I would recommend totally against smoking marijuana at all. So it would be using one of the edible or ingestible products. So the extracts, including the CBD oils, may help improve people's moods, can help with depression, may be able to reduce pain. And so there are some benefits that may be present. The problem is some of the products don't contain what they advertise. And so one would need to go to a reputable distribution center to make sure you're getting the right stuff. Smoking marijuana has been shown to damage DNA, in addition, which can cause impairment of immunity. So another reason to want to consider whether you go towards marijuana. So use of marijuana should be with great caution. The effects can be of benefit. For example, there appear to be some benefit for arthritic conditions, but that benefit looks like it's due to immunosuppression. So it may not be useful for people that already have immune deficiency. And so once again, use great care and abide by any local laws if you use and do not smoke marijuana. Birth control, sexual relationships. These are a little bit more difficult to discuss because of the individuality that's concerned there. But we as human beings are programmed to want to reproduce. That's how the species survives. And we control this urge so that we don't do anything that it potentially could harm someone else or harm us. And we go into a relationship with a mutual agreement about what we want to do and when we can do things. And only when one is old enough and mature enough and understanding the consequences should one even consider proceeding with sexual relationships. And so we shouldn't consider these as casual, just pleasurable occurrences, but they have emotional aspects. There's risk for pregnancies, there's risk for sexually transmitted diseases. And if both of the individuals involved are not emotionally and intellectually ready to proceed, one should not proceed. And so one should always take a step back and make sure one's thinking about what's going to be happening and not just jump into it. Discuss birth control methods and risk. Most of the societal manner for birth control is placed as a burden on females in our country. We can do an irreversible level, which includes hysterectomy. We can do reversible measures, which can include such things as birth control pills that regulate the body's hormonal system to trick the body thinks it's pregnant, so it can't be fertilized. in general, all of these things still lead to a risk for sexually transmitted diseases. There are some longer-term hormonal things that can occur, such as there's risk for breast, uterine, and cervical cancer in women that are taking birth control pills. And some patients with primary immune deficiency are at a somewhat higher risk for cancer to begin with. So this has to all be carefully considered, and using the type of oral contraceptives that pose the lowest risk for everything would be the best route to go. And the gynecologist should be involved, and they should discuss carefully the risk for the long-term side effects. Instead of taking a daily pill, there's Depo-Provera, which are shots they've been taken every 3 months that prevent ovulation. And again, the gynecologist should be involved in this process. There's also intrauterine devices, which are plastic or wire material that's placed in the uterus that basically prevents implantation and pregnancy from occurring. So these act as a physical deterrent, but they also typically release a hormone to prevent the pregnancy from occurring. Once again, this is a foreign body that can create problems in those that do not heal well, such as having a neutrophil abnormality. A simple solution for all of this is for the male to use condoms. This can prevent unwanted pregnancies, and it should be also part of safer sex to help prevent sexually transmitted diseases. And so that leads to the question about what are the risks of contracting sexually transmitted diseases. There's not a lot of data to know. This has not been well studied in patients that have immune abnormalities. And so we have to go with what we know about the individual types of immune problems. So once again, patients that have neutrophil problems will be at higher risk for the bacterial sexually transmitted diseases. Most patients with primary immune deficiency that have a T lymphocyte-related problem may be at even higher risk for the human papillomavirus than others. Patients that have antibody deficiencies may also be at some risk. And so I would suggest that it remains very highly recommend that all patients with primary immune deficiency receive the HPV vaccine series to try to prevent as best it can problems with this. So at this point, I will stop this discussion and let Nicole begin with some of the questions that are being raised. And feel free to ask and clarify any things I've been discussing.
Thank you so much, Dr. Harville. So we are now ready for the Q&A portion of the session. Please feel free to continue to enter your questions through the question box. We will answer as many as we can. The first question we have here is, are there any specific tests or special considerations someone with PI should take before pregnancy?
Yes, and the question, patients that have antibody deficiencies during the last trimester of the pregnancy is when the fetus receives immunoglobulin from the mother. And so most of us have made sure that during the last trimester, so the last 3 months of pregnancy, that there was additional immunoglobulin infusions being performed. And people have different patterns of this depending on if the mother is on subcutaneous infusions or intravenous infusions. For the mothers that I took care of, I would infuse them once a week with IVIG in the last trimester to try to make sure their antibody levels stayed very high in order that the fetus would come out with lots of antibodies. Now, the part of the question sort of implies the genetic risk that may be present for transmission of the disease process. And if a person has what's known as an autosomal dominant disease, then the baby will have a half a chance that they will be receiving the same disease process. But these diseases have what we call variable penetrance. And so the baby may be more affected or less affected. It's always difficult to know because there's so many variables that come to play from that. If it's an autosomal recessive process, the baby may be a carrier or may not have, and it would be likely not have any problems after the birth, but would be at risk to have a child with primary immune deficiency if they had a child that with a father that passed on the same type of gene mutation.
Thank you. The next question is, I take a lot of vitamins, but worry about damage to kidney or liver. Is there a single vitamin that you would recommend?
That is a great question. And several years ago, one of the people that was against people taking vitamins said that Americans have the most expensive pee in the world because basically what happens is almost all the vitamins that we take are lost in the urine. Now, some are what we call fat soluble. So, for example, like vitamin D is considered to be fat soluble and remains in the body. But some of the concepts that were present many, many years ago about the accumulation of vitamins in an individual and causing harm have turned out to not truly be that case. You would want to be careful about overdoing things like vitamin D and vitamin A. Vitamin A turns out to actually promote arthritis-like conditions, and so I don't recommend people taking vitamin A. But if you take a general multivitamin every day that comes from a reputable store, so a drugstore that has a reputable chain, very likely it will be fine. And I'm not sure that there's many problems. I take a multivitamin every day. I take additional vitamins. I take additional vitamin D, et cetera, myself.
Okay. And I want to try to get one more question is because we do have a hard stop at 4:15, I believe. There is a question about the implants. Does the birth control implant in the arm, next planen, does that pose the same infection risk as an IUD?
No. The simple answer would be no, because there's not something in the uterus. But there could still be infections in the arm from the device. Most of these devices are release Depo-Provera. I'm not familiar with that brand name, so I'm not sure. Most of these are done where they, every few months, Depo-Provera is actually injected into the device, and then the device slowly reaches it out into the individual. For those that have where their neutrophils work perfectly fine, there should be no increased problems. If someone has a neutrophil abnormality, there could be healing issues related with it.
Well, our time has unfortunately come to an end. Thank you so much, Dr. Harville. Please join me in thanking him for sharing his knowledge and expertise today. I hope everyone enjoyed the session. Have a great day.
Thank you, everyone. Thanks for everybody's attention.